My name is Juan. I'm a student at Stanislaus State University in the Public Health Promotion Program. This is part of my externship, so I was doing an interview. I'm actually here with Anthony. Anthony's going to introduce himself.
Sure. My name's Anthony. I'm the Health Equity Manager with the LGBTQ Plus Collaborative, specifically operating here at the Rainbow Resource Center in Modesto, located 1202 H Street. I manage and take care of a lot of the health initiatives here at the Collaborative and Rainbow Resource Center. We offer resources and services around STI referrals and prevention and treatment. We do harm reduction services such as Narcan education, distribution of fentanyl test strips. We offer our syringe service program, and that happens every Wednesday of the month at our local community parks. And our goal is to connect folks with safe use supplies and even connect them with more harm reduction resources here at the center. And one of the big things that we do here also is we offer our rapid on-site HIV test with the goal of getting folks connected with PrEP medication, which is to prevent HIV transmission. So that's just a few things.
Also, we wanted to talk about another thing that I've been working on in here with my preceptor, Jared. It's going to be DoxyPEP. Could you elaborate a little bit on exactly what DoxyPEP is, what it's for, and what the goal is?
Right. So the goal with DoxyPEP, it's actually like an emergency medication that folks can use. I oftentimes compare it to the morning after pill or Plan B. It's within 24 to 72 hours, and it's a pill that you take to decrease your risk of transmitting or even getting things like syphilis, gonorrhea, things of that sort. When it comes to that specific pill, you can get it from like a local provider, whether that's through a pharmacist. They actually have a thing in California where you can go to a pharmacist and you can request DoxyPEP, and it's for men who have sex with men, trans women, and also people who are part of the queer community in general. That's like when it comes to the pill, you can.
Right.
So when it comes to that, you can actually use the medication, and it's for a fast-acting kind of like a treatment plan for decreasing your risk of getting any type of STI.
Okay, so, and will the collaborative be offering any type of services? I mean, I know that was the goal that we were working on with my plan that we were working for DoxyPEP in that program. Will the LGBTQ collaborative be offering those services hopefully pretty soon?
So what we want to do with that is, one thing we're getting is our harm reduction vending machine. That's going to be located in our suite next door. What we're trying to do is we're trying to work with local physicians and local pharmacists to see if we can have a supply of DoxyPEP actually operating out of our vending machine. So when it comes to having that, we can only refer folks out to get that, but what we want to do is actually have it on site, so that way someone has an experience, and they're worried about contracting, for example, chlamydia or syphilis, they can actually come to our center, 24/7 and actually get that out of our vending machine. So that's something we're actively working on.
Okay, now. And is that something that looks like it's going to really work out then in the long run?
So
with the reduction,
it's promising because we actually have like a local family medicine physician and also addiction specialist. They are actually in partnership with the pharmacy, and they're trying to get a supply for our collaborative. They do street medicine, so they want to be able to supply that to the folks that they're serving, and also our organization, since we serve such a large clientele.
Okay, and then as far as Jared goes, since he's the preceptor, exactly what does he do, if you don't mind kind of maybe elaborating a little bit on that, because I know Jared was unfortunately unable to attend this interview.
Sure.
Because of other issues. There's things that he's taking care of with work and stuff like that. So I kind of wanted to get an input on that.
Sure. So Jared's actually our executive director here at the Rainbow Resource Center. They kind of oversee like the kind of like the even flow of like our organization, and they also oversee my position in health. I'm the health equity manager, but they kind of oversee and give guidance to me when it comes to a lot of the health initiatives. So a lot of these things that we're hearing about, the efforts around DoxyPEP, the harm reduction vending machine, they're all in the background with me, kind of making sure that these projects and initiatives are moving forward in a tangible way.
Okay, so. And then my last question that I have for you really quick, actually, what type of advice do you have to give other individuals out there that are LGBTQ that fear of getting tested, whether if it's HIV or getting access to DoxyPEP? What's your advice, or the stigma that that people have towards that? What's your advice to give to other individuals in regards to breaking that?
Sure. I think it's important to validate a lot of those fears, right? Because bottom line is a lot of like our healthcare system, especially, Stanislaus County, and that goes for many parts of our Central Valley. It can be very stigmatizing. It can feel scary to kind of go to those services. But I think like, coming to places like here, our resource center, and like having that access and connection to, gender affirming, sex positive, physicians that we work with, and kind of like seeking out those resources and seeing that there's ways in which like we can infiltrate healthcare and be in those spaces and provide that education. We're actively working on providing the kind of like inclusive education, whether it's like in the healthcare field, in the schools, for our youth. I think that's something that I could say confidently that we're doing here, and kind of trying to change the narrative when it comes to seeking out healthcare. And oftentimes what you can hear is decrease your risk. But one thing that we kind of emphasize here is like protecting your pleasure, right? That's one thing that we really emphasize here is getting away from words that sound scary, getting away from these things that are associated with risk, and instead pointing people in the direction where they can feel comfortable talking about, their sexuality, talking about sexual interactions they might be having, or even just wanting to access something like DoxyPep. We should decrease the barriers as much as we can, and I feel we do a good job of doing that here.
All right, and is there anything else you would like to conclude at the end of all, is there anything you'd like to share, anything?
Sure, I just, as in the position that I am, I just want to say I am someone that's learning, and we're actively trying to just serve our community to the best of our ability. We're still learning. I myself, in the position I am, I'm learning from the clientele that come here, and I just want to like emphasize they're the experts when it comes to a lot of these issues. And I just want to say, when it comes to our Rainbow Resource Center, we inform a lot of our health initiatives based on like the folks that we serve. They're the ones that inform a lot of the work that we do.
Okay, all right, Anthony. Well, thank you so much for your time and taking this opportunity to do this interview for me and for everybody else to see. And I really appreciate it.
Okay, and thank you so much.
All right, Anthony.
I appreciate it.
And thank you.